Kansas City, home to world champion Kansas City Chiefs, and the 2015 World Championship Kansas City Royals. Barbecue, jazz, theater, museums, shopping, and so much more make Kansas City a cosmopolitan gem of the Midwest, and a place nearly 2.4 million people call home. The University of Kansas Medical Center near downtown Kansas City is the premier academic medical center in this region and is a national leader in many fields. It employs nearly 9,000 individuals. Last year, the health system reported nearly 2 million outpatient visits and over 83,000 hospital discharges. Committed to the underserved, $68 million of uncompensated care was provided. The Clinical Psychology Internship Program at KU Medical Center is sponsored by the Department of Psychiatry and Behavioral Sciences, an academic department of over 50 faculty members, 20 of whom are psychologists. The internship program has proudly graduated interns for nearly 20 years from home institutions at major doctoral programs throughout all regions of the country. Our alumni have gone on to become leaders in their own right in many fields. The majority of graduates work in academic medical centers, and almost all pursue and achieve postdoctoral residencies following the completion of their program. The people are what make a great internship. While you can't be here with us in person yet, we want you to meet some of the fine folks working in our program.
Hi there and welcome. I'm Dr. Edward Hunter, and I am the Director of Training in the Division of Psychology. We made this video to give you a sense of what our internship program stands for and what we hope to provide our trainees. I am so proud of our faculty and decided that the best way to do this is to just let them tell you something about who they are. I hope you enjoy it.
Greetings. I have the privilege to be the chair of the Department of Psychiatry and Behavioral Sciences here at the University of Kansas Medical Center. My name is William Gabrielli. People call me Gabe. I have background in medicine, psychiatry, and psychology. I want to take this opportunity to invite you to look at our psychology internship program. The program is a great one in my view. We've built it in our department over the last quarter century that I've had the privilege to be chair. And I think you'll find that if you look at the program, it has a lot of the things you're looking for. We have a good opportunity to provide you with experience with a diversity of patient population. We have a seasoned and experienced faculty, and we're a supportive team. As we push back the frontier of knowledge through your efforts as you go forward in your career, we will make a difference in the lives of your patients. Thanks for thinking about us.
Hello, I am Monica Curlo. I am the director of the Psychology Division in the Department of Psychiatry and Behavioral Sciences here at the University of Kansas Medical Center and KU Health System. Welcome to our internship training program. Psychology is very appreciated throughout the hospital and the health system. Our interns have the ability to work with any number of patients and get certainly a wide breadth and depth of experiences. The other thing that I love about working at KU is the camaraderie. So we have a very large psychology faculty within our department of psychiatry and behavioral sciences. We now have 20 faculty members, and we are growing very rapidly. I hope over the next few minutes you have an opportunity to learn more about our internship program and its fit with your training needs.
And so actually over the last few rotations of interns, they've expressed an interest for having more professional development, more informal just discussions of what does looking for a job look like? What is a CV? How do I even think about making decisions on what job to take? Professional dress. And so in having conversations with interns, discuss with some of the interns the idea of having an informal monthly seminar in which is professional development. This development is for interns. I don't drive it, you all drive this process. And so every month we get an agenda that's purely fed to me by the interns of what's on their mind. And so we discuss and kind of rank the agenda items, and we go through those things that are really salient to you all as interns. And so I was there some years ago, and so it's really kind of interesting for me to kind of go back to what that was like to be an intern ready for postdoc or a staff position, and how do you assimilate your experiences and kind of conceptualize what you want to do and who you want to be as a psychologist.
I'm Liz Monks, and I'm one of the psychologists that works at the Cancer Center. You know, we try to really incorporate diversity in everything we do, from didactics to all the supervision across the board. Interns pretty consistently said that it would be really helpful to have dedicated space and time to discuss all things diversity, from personal experiences, how that impacts clinical work, the things that patients bring into the room, differences that we all have and experience, all of our different identities and how they interact with all of our patient identities and operating in a medical system. So Dr. Alt and I kind of put our heads together to develop some ideas on things that we could focus on, but really try to also take the lead from our interns to let us know what they need and how we can be most helpful. But this is a little bit more intimate and personal. So it's nice because we get to know them, and I think they get to know each other a little bit better also. And we kind of started off opening it up to, let's talk about the potential things that we could address every month, and gathered their ideas. We've already covered microaggressions and spent a lot of time talking about power differentials when you're a trainee, and how to manage what to do when you experience something that makes you uncomfortable with a patient or for yourself, and how to speak up, how to be an ally. We're making conscious efforts to make sure we pay attention and discuss kind of the current events and the current culture around us also. Very focused on, like, we want this to make a difference. We want this to be useful for them, not just another hour. Everyone is super busy, so we wanted it to be worth it. And we've gotten the feedback that it has been. Until you talk to somebody and hear about their experiences, there's so much that we don't know about each other, and so much that opens up when we really do get a chance to get to know everybody and the different ways they identify and operate in the world.
Hi, my name is Shauna Wright. I am a licensed psychologist, and I have the pleasure of serving as the Associate Director for KU's Center for Telemedicine and Telehealth. So prior to the COVID-19 public health emergency, our center was heavily involved with training across disciplines for telehealth. In response to the public health emergency and the rapid stand-up of telehealth across the health system and really across agencies and healthcare organizations in the state, the Center for Telemedicine and Telehealth took really a multi-pronged approach to help people get caught up and ready to go. So it's important to us that they not only know how to use telehealth, but understand the fundamentals of telehealth. And that includes telehealth administration, that includes the technology behind it. But with our internship, we've wanted our interns to walk away from the internship not only feeling like they know how to use telehealth, but that they may help their employers in their next position understand telehealth and how to legally and ethically practice telehealth.
The Marillac Center houses the Child Inpatient Psychiatry Rotation, which is a standard element of the program.
My name is Tyler Draghi. I'm a clinical psychologist here at KU Medical Center. So one of the major rotations for the psychology interns is out here at Marillac on the inpatient unit. And so my role is a primary supervisor of the interns. And so I help them kind of get accustomed to the rotation, meeting with families, meeting with the children. We get consultations from psychiatry. All interns come in with varying degrees of comfort in working with children and adolescents. And so we just ask for the intern to be open to the experience. One of the really nice parts of our rotation is you see a wide variety of psychopathology here. And you see, from ADHD behavioral dysregulation to pretty severe mood disorders, psychosis, those types of challenges. And so you get a really good breadth of experience. Some internships that I've, even been a part of have been very narrow in its scope. And one of the real strengths is there are so many different opportunities and people that are very passionate about training and about seeing interns develop. I think the psychologist team here really gets energized through training, and there's such really good support around it.
I'm Danielle Johnson. I'm one of the licensed psychologists out at the Marillac campus, which is an acute inpatient psychiatric facility for kiddos ages 4 to 17. And in this role, I provide supervision of the interns in our postdoc, as well as provide assessment for kiddos that are being consulted for our service line for diagnostic evaluation or clarification on their presenting concerns. So as an intern, you would get a pretty diverse experience while here. So in addition to doing assessments in which you get to help clarify diagnostically the kiddo's presentation, you have the opportunity to do groups with our pre-adolescents and as well as with our adolescent population. You will get to work with a multidisciplinary team in helping with psychiatry. We have a group of therapists, as well as our expressive therapy group to help clarify what's going on with kiddos, provide clinical input. We also do behavior plans when kiddos are struggling with behaviors on unit, helping to work with staff to make sure that they're being as safe as possible and giving us really good reinforcers. So we really want you to walk away with knowing what children are, how to work with them, how to do some assessments with them, and how to work with other colleagues that are in different disciplines as you. I think this internship gives you a great chance to try multiple major rotations that will really kind of dip your toes in the water of any place from our rotation of inpatient child psychiatry to adult psychiatry to cancer center to neuro rehab. There's such a diverse experience here that I think you'll get a better chance of honing in what you're really looking to do as you develop into psychologist.
The Strawberry Hill campus houses the adult inpatient psychiatry experience, which is also a standard element of the program.
Welcome, everybody. My name is Albert Buddy Poggi, and I'm a clinical psychologist in the Department of Psychiatry and Behavioral Sciences. I serve the internship program as the primary supervisor for our adult inpatient psychiatry rotation. And in that rotation, we work alongside our medical students, our psychiatry residents, and psychiatry faculty. So I've always been interested in kind of, biological psychology. And so it fits right in with some of the experiences that we have day to day and some of the things that you'll be exposed to in working in not only psychiatry, but kind of throughout the health system during your internship program. And the work that we do involves inpatient mental health care. And so I've always thought of this as a great opportunity to learn about psychiatric disorders, their diagnosis, their treatment, how they are managed in terms of stabilizing somebody that might be, let's say, acutely suicidal, acutely manic, acutely, psychotic. Now, for you and I, we'll recognize the things that we do as counseling, psychotherapy, case conceptualization, diagnostic work using psychometric and cognitive tests, preparing reports, individual advising, family counseling, family meetings, consultation with our colleagues, but to also learn about medications, approaches to treatment, access to mental health care in the community, kind of how the mental health system, works as a whole.
The NCI-designated University of Kansas Cancer Center houses the psycho-oncology rotation at KUMC, a full elective activity. 6 psychologists, including Dr. Marcus Alt, work predominantly in this center.
I'm Dr. Marcus Alt. I am one of the licensed psychologists that work at the Cancer Center. I'm one of the oncopsychologists. Kind of my role with the internship program is I serve as one of the primary supervisors for the interns as they are rotating through the Cancer Center. And so I'm excited to continue to be a part of the program, excited to continue to be a part of your training experience as well. So one of the kind of cornerstones of our program is what we call the health and behavior assessment experience. And so basically what that looks like is the interns and the trainees are embedded in the oncology clinics, working side by side with the oncology providers. And that really allows an opportunity to assess for any psychosocial needs. Obviously, a symptom assessment, there's any safety concerns that might be addressed, but it also provides just kind of an introduction to the importance and the significance of addressing emotional distress when it comes to cancer care. The intern will also spend a day doing inpatient work. The teams will send in consults for patients that they would like us to see, and the intern will have an opportunity to work pretty closely with Dr. Katz and Dr. Monks to respond to those consults. Kind of the third main element to the rotation is the individual therapy or the individual caseload. We feel pretty passionate and pretty strongly about the importance of supervision, not just individual supervision, which certainly there'll be an hour a week of that, but also kind of group supervision. So we have the opportunity to have what we call tiered supervision. And that's really taking place during the hour and a half a week group team meeting that we have. So again, kind of a wide variety of experiences that are a part of the rotation. We know that there's a lot that can be learned in a little amount of time. And so we want to give the intern as much opportunity as possible to experience as much as possible.
The Neurorehabilitation Psychology Training Program is led by Dr. Monica Curlow. This is a full elective activity.
I'm Dr. Monica Curlow, and I am the neurorehabilitation psychologist in the departments of psychiatry and behavioral sciences, as well as the Department of Rehab Medicine. Our work is all inpatient work for the neurorehabilitation psychology rotation. We have a 29-bed inpatient rehabilitation unit. We also are very active on our inpatient accredited burn unit. We also work on the medical surgical trauma team. And with those patients, we could be seeing them as early as their ICU start of care. We work with all of those patients with regard to helping determine their cognitive status, as well as helping with non-pharmacological pain management techniques and doing some evaluation and treatment, brief treatments to assist with coping and adjustment to any kind of either temporary or permanent functional changes. In some cases, having to deal potentially with end-of-life issues. And we also assist staff at times with debriefings if they're having a number of very challenging situations. Well, I think by the end of the rotation, they have a pretty good experience and understanding of how to work in an interdisciplinary team. To be honest with you, the reason why I came and took this job 15 years ago was because I really missed being able to teach and train students. The intern and postdoc office shares a door kind of with one of our administrators. And she sometimes hears the interns and postdocs and practicum students laughing on the other side of the door, and then gets a little jealous and wonders what they're laughing about.
The Department of Family Medicine and Community Health and the Department of Internal Medicine partner with the Department of Psychiatry and Behavioral Sciences to form the primary care rotation at KU Medical Center.
Our interns are pretty quickly drawn into the family medicine practice. The intern is just pulled into rooms by the physician for whatever reason that might come up. And that might be from smoking cessation to suicidality and everything in between. There's never a day that I work there that I don't learn something that I did not know before. You just never know what you're going to get or when you're going to get it. Some days might be very peaceful and slow, and some days might be very, very busy where you're just running from one room to the next. I really like the pace. I really like that every day is different. I really like the opportunity to work with all the different learners too. So we have students from a number of different disciplines, and I get to work with psychology learners at the practicum, intern, and fellow level, and that really enriches me and helps keep me current.
Interns carry 6 hours of outpatients in the outpatient psychiatry clinic throughout the year. Dr. DJ Garcia is one of the supervisors for this rotation.
My name is Dr. DJ Garcia, and I was fortunate enough to do both my internship and my postdoc fellowship here, following my training in the clinical psychology doctoral program at the University of Tennessee in Knoxville. I had no prior experience in health psychology and related things. And so when I got here, it was all new to me. Part of why I came here was because the breadth of training was so excellent, and I knew that I'd get excellent training across a variety of areas, and it really just hasn't disappointed at all. Do a lot of outpatient psychotherapy right now with a variety of different patients, both English speaking and Spanish speaking. So I'm bilingual, so I do therapy and also evaluations in both English and Spanish, and there's plenty of opportunity to do some of that here, and it's been a real good fit for me. My role with the interns, I'd love to do group supervision, individual supervision. I really see that as part of, hopefully part of my future here at KU. I want to really be more involved with the training. I really had people who are invested in me and my learning, and I think that made all the difference.
The Psychodiagnostic Evaluations for Medical Interventions, PEMI, program is explained by its author, Dr. Jessica Hamilton.
I'm Dr. Hamilton, but I will always go by Jessica, and I'm one of the faculty here. I've been here now for 6 years. I spend 3 days a week over at the Cancer Center, and then I spend 2 days a week as the director of a program over at the MOB. And that program is the Psychodiagnostic Evaluations for Medical Interventions, which is a very long title. And during that rotation, some of the things that we do are pre-surgical evaluations for solid organ transplants, bariatric surgery evaluations, as well as spinal cord stimulator evaluations. The cool thing I think about the PEMI rotation is that you get that integrative and assessment report writing in a health setting, but you also are going to be collaborating pretty heavily with me. And that what we do is you interview the patient, and I really am encouraging people to learn the skill of writing and of doing your interview and typing at the same time. I actually come in at the end, go through and confirm the information that you collected during the interview, and then together you and I collaborate on making recommendations for the patient and giving those to the patient as well as to the medical teams. So I guess I'll just tell you now, if you don't know already, I was an intern here at KU, and then I did my postdoc here, and now I'm faculty. And I always just say that the reason why I stayed is because I truly enjoy the people that I work with. I think you can find patients anywhere for the most part, because the world is filled with humans, but being able to come to work and know that you enjoy working with the people that you work with on a day-to-day basis is incredibly important.
In addition to the comprehensive track, the program has a special underserved populations track. Interns do most of the activities of the comprehensive track, but also these interns do a 3-month on-site rotation at the Community Health Center of Southeast Kansas, an integrated primary care program which provides compassionate care to rural and underserved populations in Kansas.
First of all, I'd just like to welcome the applicant. That we are just delighted that you're interested in our program. We're very much interested in meeting with you, talking with you, and showing off a little bit of our program here at KU. We find that working with interns are really something special. I always enjoy it, and it's amazing to me that the interns bring us something as well as we bring something to the interns. I like to talk to the interns about finding their voice, and I always talk to them about that when they first come in. You're going to find your voice in the sense of dealing with patients and in psychotherapy. And they always look at me like, what are you talking about? You know, I have a voice already. But they always get it around this time of year, around December. They find their own voice. They find a way that they start talking about to patients and talking with patients. And they get that sense of confidence that they know what to do and know what to say next. It's really kind of exciting to watch that process happen.
Hi again. I hope this video has helped you to catch the spirit of who we are. We're glad you're considering our program. Have a great day.
The University of Kansas Medical Center Clinical Psychology Internship Program. There's nothing quite like it.